So, good afternoon ladies and gentlemen. I've been called to this 10-month-old. Mum's rang us because she's concerned that the child is choking. So first part of our assessment is we walk in to make sure that the scene is safe for us. We've assessed that and it's fine. Then we move on to our pediatric assessment triangle, and the first thing we notice is that they're having difficulty breathing. So then we would go and we would take the child, and we would assess their work of breathing. Are they coughing? Are they coughing effectively? Is there air going in and out when they're coughing? And if so, we would just encourage them to cough, and perhaps even maybe just 5 sharp back blows to help them expel any foreign object in their airways. If they're just continuing to cough like that, we would just leave them as comfortable as we can, make them comfortable, and we transport to hospital as soon as possible. However, if they were in an unconscious state, if they were in a state where there was no air movement but they're still conscious, then we would immediately put them on their stomach, put them in this position, and supporting them 5 quick back blows. Then turn them over, and then we would do 5 chest thrusts. 1, 2, 3, 4, 5. And we would continue this until the object is expelled or the child becomes unconscious. Now, should the child become unconscious, then we would grab our McGill's forceps and we would look down the child's throat and just see if we can find any foreign objects that we're able to remove. But we have to wait till the child's unconscious first. And failing that, then we go into the full CPR, cardiac arrest scenario for a child. So 15 compressions to 2 breaths, and call for backup. And as soon as we can, let's get them to the hospital and get that airway open, and the child's safe. So just a quick recap: if they're conscious and they're coughing, just supportive measures. Maybe if we feel it's necessary, 5 quick back blows. If there's no airway involvement, if there's no airway at all, they're completely occluded, then we do 5 back blows followed by 5 chest compressions, and continue until and then rapid transport to hospital, unless they become unconscious, and then we move the McGill's forceps, and after that CPR, full CPR scenario. Thank you very much.